Education Series, Module 7, Teeth Throughout the Life Course, Part 1. I'm Dr. Brecky, and I'm here with Ready, Set, Smile to talk about the teeth throughout the entire life course. Module 6, Teeth Throughout the Life Course, is aimed to provide a journey across populations throughout the lifespan, which face unique oral health needs and/or considerations. These materials are subject to copyright by Ready, Set, Smile and Dr. Brecky. Teeth Throughout the Life Course, Part 1 and 2. We'll review aging, the eruption cycles of the dentition, pregnancy, infancy, childhood, adolescence, adulthood, special needs populations, and older adults. Humans require the oral cavity, or mouth, as an essential component of our social, behavioral, and biological experiences of living. Yet, humans face unique changes and challenges relating to the oral health cavity across the life course. So, what's so important about our mouths and teeth? Well, smiling, communicating, speaking, breathing, eating, protecting, and engaging in romantic behaviors. They're pretty important for all different aspects of life. Aging. Aging is associated with changes in dynamic biological, physiological, environmental, psychological, behavioral, and social processes, according to the National Institute of Health. So, whoa, what are these words? Polyphyodont and diphyodont. Polyphyodonts are animals with multiple sets of teeth which replace themselves over a lifetime. This is something like a lizard. A diphyodont, humans have 2 sets of teeth, and these include all animals with 2 sets of teeth. But we're lucky to have 2. First, we have baby teeth, or primary teeth, and then we have adult, or secondary teeth. It's really a blessing that we get a whole second set. So, how many teeth should we have? Well, for baby, or primary teeth, also called deciduous teeth, the normal amount is 20, whereas for secondary or permanent adult teeth, the normal amount is 32. This can vary based on person to person, but this is the usual amount for most people. So what are some changes over time that occur within our oral cavity? Well, there's a lack of dentition early in life, the development of dentition, both primary and secondary or permanent, the eruption of the primary dentition, the loss of primary dentition, the eruption of the permanent dentition, the maintenance of the permanent dentition, and then the possible loss or restoration of the permanent dentition. So this is a big span of many different oral health needs that occur over one's life. We'll start by talking about pregnancy. There are over 6 million pregnancies in the US per year, resulting in over 4 million births. Pregnant women and their oral health considerations include increased nutritional needs, more frequent eating habits, gingival or gum tissue changes, including things like bleeding or puffiness, morning sickness and enamel erosion, dry mouth, and an increased caries risk. So what about thinking of the fetus during pregnancy? The development of the facial bones, teeth, and oral cavity begins well before birth. 6 to 8 weeks after conception in utero, primary or baby teeth begin to develop. 4 months in utero, permanent teeth begin to develop. Now at birth, the permanent first molars become calcified or hardened. Now just keep in mind, the early development of critical structure sheds light on the importance of a well-rounded, proper nutrition during pregnancy, not only for mom, but also for baby's oral health. So what about pregnancy and dental treatment? Is it safe? Well, visiting your dentist before you become pregnant to prevent problems during pregnancy is really key. However, routine dental care is recommended during pregnancy. Routine x-rays are also considered safe given the proper preventive measures are followed, and this is advice from the American Pregnancy Association. The most important thing is do not delay necessary care. So what are some pregnancy considerations? Well, again, I said, do not delay dental care. If your gums bleed, keep brushing. It's completely normal to have puffy gums during pregnancy that result in extra bleeding. It's usually linked to hormones. Emphasize fluoride, especially for those with morning sickness who might be having issues with vomiting food and suffering from erosion of their teeth. An adequate nutritional intake is really, really key, again, for both baby and for mom. Drinking tap water and taking extra care of self and teeth. Again, do not delay care. In 2017, there were almost 4 million births. Nearly 10% of these infants are born prematurely, which is important. Oral health considerations to think about for infants include feeding, frequent feeding, teething, thrush, which is a fungal infection that can develop, frenum attachments, which basically, if we haven't discussed before, are the little gum attachment above your two front teeth or in between your lower two front teeth. Not everybody has large ones, but they can affect suckling and breastfeeding, and also thumb, nook, or any other possible oral fixation habits that begin. So what are some considerations for infant oral health? Establish oral hygiene. This is the biggest thing for parents and caregivers to establish at a young age, is a great oral hygiene routine. Assess prematurity. Premature infants do have more oral health needs and considerations as their teeth may not have been fully developed at the time of their birth, meaning they're more prone to dental issues. Assess non-nutritive oral habits like sucking on the thumb, sucking on the nook. Analyze frenum attachments, just like we discussed. Discuss fluoride intake and application. It's really, really, really important to get a little bit of fluoride, but not too much. Discuss teething. Review nutrition and breastfeeding, and establish an initial dental visit, which is recommended by age 1. So what's the eruption cycle of primary dentition? Well, the 7+4 rule is a great way to remember baby teeth. Now, this isn't exactly the same for everybody because all children have different modes of development. However, starting at about 7 months, a child should have 4 additional baby teeth that then erupt every 4 months. So at 7 months, you should start getting the first set, starting with 2 on the bottom. And then every 4 months, you should basically be getting a full set. Remember, the eruption cycle may vary for every child. Some children are even born with teeth. So you can take a look at this eruption cycle. This also shows the eruption cycle of permanent teeth by indicating when these baby teeth are shed. So you can just take a look at this, but this, includes the 20 baby teeth. Oral fixation habits. Pacifiers, nooks, thumbs are common tactics for young children to practice oral fixation. This habit can last a lifetime for some. However, these can cause drastic changes in a child's bite or occlusion, the shape of the teeth, which increases the need for braces. It's really important to try and nix these habits by age 2 or 3. Caution! Be careful what a child puts in his or her mouth. Why? Well, not only because of choking hazards and possible toxins such as lead, but also caregivers are often the first exposure to the infectious bacteria which causes tooth decay, as we discussed in our dental caries lecture. So just remember, be wary. So what is some advice for moms, dads, caregivers? Breastfeeding helps the teeth and arches to align, and breastfeeding can be achieved even when a child has teeth. Brush the gums before and after the teeth erupt. Once the teeth do erupt, begin brushing with fluoride toothpaste, just a smear. Eliminate pacifiers or nooks before age 2. Be aware of what's placed in the mouth. And put children to bed with water, never milk or juice. Choose healthful foods with few added sugars, and don't share saliva. We talked about that. Lastly, do not forget your own oral hygiene needs. Childhood. According to the U.S. Census data for 2019, there are an estimated 78 million children under the age of 18 in the United States. When we think about this age group, things to think about related to oral health include increased introduction to sugars in the diet, eruption of the permanent teeth or in the loss of primary teeth, development of individual oral hygiene behaviors, establishing a dental home, and addressing spacing, crowding, or issues with occlusion. So let's compare primary teeth versus adult teeth. Are they the same? Are they different? Well, primary teeth do have weaker enamel. They are more prone to cavities. Adult teeth have stronger enamel. Primary teeth have large internal chambers for blood vessels and nerves, whereas adult teeth have smaller ones. Primary teeth have a shorter trunk. Adult teeth have a longer trunk. They're more ingrained within the bone and stronger. Primary teeth have increased spacing between the teeth. This is actually beneficial for children as it helps them to naturally push saliva through those areas and keep cavities away. Adult teeth have minimal spacing in between teeth, which is what we want, a nice tight tooth relationship, because that also helps to keep food from getting stuck in between your teeth. Primary teeth have divergent roots, and adult teeth have less divergent roots. Again, they're more strongly placed within the bone. Primary teeth have a lighter coloration, and adult teeth, unfortunately, have a darker coloration. Too bad they're not bright white. So the eruption of permanent teeth, this is a full guide of, basically it starts around 6 years, and if we're counting our third molars, it continues until one is about 21. Mixed dentition. This is the period in which primary or deciduous and permanent or adult teeth are present together in the oral cavity, and this is ages 6 to 13. Things to think about: primary teeth are more susceptible to cavities, and again, that bacteria can spread. We want to make sure those adult teeth stay clean and healthy during this mixed period. Spacing and crowding issues. Speech deficits may also arise. Trauma and injury is extremely common in this age group. And the biggest one, poor oral hygiene habits. It is the most important time to really, really establish good hygiene routines. Orthodontics. Well, it's really not just for looks. The real focus is occlusion. The main goal of orthodontics are improving chewing, speaking, and the cleansability or natural cleaning abilities of the teeth. They may also help to prevent jaw issues. So braces, what's exactly the catch? Well, just about anything a person with braces eats, actually. If you think about it, they're kind of like a cheese grater. Children and adults must be hyper vigilant about removing excess food and debris from braces, which is 10 times as hard as it is with regular teeth. This may cause increased risk for tooth decay and periodontal or gum disease, so it's extremely important to take better care of your teeth when wearing braces. Pregnancy, infancy, and early childhood shape one's entire life trajectory for oral health. This is why establishing good oral hygiene habits, eating the right foods, and routinely visiting the dentist are the best ways to invest in a healthy, lifelong smile. Thank you to our sponsors. With questions regarding this module, please contact BreckyHuddleston@gmail.com, and we will see you next time for part 2 of Teeth Throughout the Life course. Thank you.